Hi, I'm Dr. Victoria Mwebe Katasi, a Pediatric Neuro-Oncologist and Hematologist. I am a specialist that treats children who have cancers of the brain and spine and also blood disorders. I am also the first trained African Pediatric Neuro-Oncologist in East Africa and currently the only Pediatric Neuro-Oncologist in Uganda as well. I'm currently a fellow of the Brain Tumor Epidemiology Consortium of North America, which is aimed at helping me grow in my research in the field of brain cancers and spine cancers, and also a fellow of the African Cancer Leaders Institute, which is also aimed at helping me grow in research, but also as well as leadership in the field. My interest in pediatric oncology started way back when I was working at the Cancer Institute. One morning, as I was on the ward with one of my colleagues, a mother walked in with a child who was about 14 years of age. He had a blood cancer called leukemia, and we had treated him for about a year. But because the parents were unable to keep coming to hospital, they had absconded from care. So this morning, the mother came in with a son who was swollen from the face, the shoulder, and the neck, and he was pretty doing badly. I had never seen anything like it before. So my colleague and I put the child on the bed and started giving emergency care. We quickly called for the consultant. We resuscitated this child for about 4 hours, but eventually lost the child. And that day I made up my mind that I was going to become a specialist who treats children with cancer and brain tumors. In addition, at that point we actually needed a pediatric ICU for this child. But in the entire hospital of Mulago, there was no ICU for children. So my second goal was to be part of a team that would set up a pediatric ICU. And currently, the program that I work with in Texas actually set up a pediatric ICU in Mulago, and I was the first pediatrician to actually work in this pediatric ICU. So the goals that I actually had at the beginning of my practice are things that I've actually seen come to pass. So speaking about the impact of the program that I have set up as a brain tumor program, I currently work under Mulago National Referral Hospital in conjunction with Texas Children's under the Global Hope program. This program is geared towards providing care for cancer in children in low resource settings, and so Uganda is one of the sites where this program has been set up. So we started up a clinic that treats children with brain and spine cancers in 2019 of March, and it's still currently running. We work together with the neurosurgeons in Mulago National Referral Hospital and also in Mbale Kiwa Hospital. And together we have formed a team that now takes care of these children. So our program is the main site where these children are actually given chemotherapy, and then also coordinating together with the neurosurgeons to make sure they get their surgeries well, and coordinating together with the radiation department to make sure they get their radiotherapy. So I have been the one who has written the protocols that we are using, of course adapted from the Western world. And I'm also currently in the process of actually running research on these children with brain tumors so that we can actually come up with evidence-based protocols that serve better for our own setting.